you very much for that, and thank you for the invitation. Just to start off by saying a few words about the Socialist Health Association. It's one of Labour's oldest socialist societies, and it's one of the biggest. And we engage with Labour members in constituencies, regions, and national level. We come from a tradition that recognises that society, its structures and the inequalities in society determine health. And as socialists, we understand that the health service is absolutely key in trying to fix some of these problems. We know this bill is not about integration. It's about commissioning services based on restricted budgets, irrespective of population need. We think it will lead to widespread denial of healthcare. We believe the current regulated healthcare market is bad, but that the proposed unregulated market will be even worse. This will take us from the frying pan to the fire. The SHA is acutely concerned about staffing issues and outsourcing. We can see it's a route to low pay and no or poor training for our colleagues. The accountability for the NHS has always been weak, and it will become even weaker under this bill if it goes through. It'll become weaker at the level of the councils, and it will also, I mean, it's just such a terrible message that we see that the bill has been implemented even before there has been parliamentary consent to it. These ICSs exist in shadow form, an absolutely astonishing move which completely ignores the democratic structures in our country, and this is already happening. So what can we do about the situation? One of the difficulties we have is this is a complex structural change, and it's something that a lot of people have difficulty in understanding the significance, the huge significance in the private sector seizing control of the whole process of purchasing healthcare. So how can we make this more concrete, more accessible for people to appreciate? Well, we, and I think most of the organizations have done some work around the NHS birthday rallies back in July. Maybe people were exhausted post-COVID, but we really struggled to be able to deliver the sort of demonstrations and the protests at the level that we need to, considering the challenges that we're facing. So what are the other angles we can look into? Well, in addition to this, one of the things that we've done locally, for instance, is to identify very closely with some of the fights of outsourced workers. As the message really from the outsourced workers' struggles is that they show the future of the NHS to all staff. The hell which is outsourcing in the NHS, pitiable levels of sick pay, pitiable levels of pension payments, pitiable pay and conditions and maternity leave and paternity leave and so on. That is what the future is for the whole NHS, unless we're able to defeat this process that's going on. So we have to get behind all of these struggles, and they're breaking out throughout the country. And these workers are overwhelmingly Black and brown workers who have got these jobs. And it is a really important message that we say this hell that they're facing is going to be spread across the NHS unless we all work together to fight against this. So I'm absolutely delighted today. We've got a speaker from the GMB. Thank you very much for coming along, and we really need to work together with that. But let's pick up on some of the other issues where we may have some leverage in fighting against this. And one of them is obviously to work closely with local campaigns. There's been some mention about the importance of the Health Campaigns Together group, which unites people campaigning across the country, builds broad umbrella actions, and works closely with the trade unions as well. We're very much part of that, fully support that. What a brilliant initiative. And we are very, very committed to working jointly with other organisations across the country. For those of you who are going to the Labour Party conference, which is coming up, do come and speak to us at the Socialist Society stall at the Labour Party. We have a motion going to the conference about the very issue we have been discussing. And we would really like to engage with you and discuss further with you about how we can build leverage inside the Labour Party to make sure that we continue this fight. And it was so good to hear our shadow health spokesman taking such a firm line in opposition to this bill. So thank you very much again. Okay.